Um, Ma'am, I have you in my office today, and I'm glad you came. I know that you have been um, taken care of, and your physician has informed me that you've had a traumatic head injury, and that you are on a dysphasia 1 diet, and that you have dysphagia, and that you have had memory problems, and also that you need a lot of cues in order to get compliance from people. Um, so what I'd like to talk to you today about first is the whole dysphagia team. There's a large group of people that you're going to work with, and the team includes physicians, nurses, dietitians, speech pathologists, occupational therapists, physical therapists, and we're going to work together in order to try to get you back to where you need to be. Myself and the speech pathologist are going to work hand in hand for sure. But the first question I want to ask you is what area or what part of the swallowing process are you having trouble with?
Um, my physician said it's somewhere around here.
Okay, that looks like it's going to be the second phase of swallowing. There's 3 phases of swallowing. The first is the oral phase, and that uses voluntary movements. And the second phase, which I believe is your case, is having problems with the pharyngeal phase. And then the third phase is the esophageal phase, and that would be down here. And the pharyngeal and esophageal phase both involve involuntary movements. Um, so I also want to let you know that the brainstem controls swallowing, and so uh, another important aspect that I want to make clear is what dysphagia is, and that is when you have dysphagia, you have trouble swallowing, and you have difficulty with the whole process of swallowing. It could be at different phases, or it could be at one particular phase. So that's what dysphagia is, and it's not a diagnosis. It's more of a symptom because it's caused by various disorders. What we want to look to do and focus on is manage your weight loss and manage how much intake you get, so that way you don't become malnourished. Those are what we're going to try to focus on. The main primary concern with dysphagia is aspiration, and aspiration can lead to something called aspiration pneumonia, which you want no part of whatsoever. So what we are going to try to do first is look at your anthropometric data and look at your dietary intake before your traumatic head injury, and then food patterns that you had also before your traumatic injury. So what are some of your favorite foods that you like to eat?
I like to eat fish. It's my favorite meat. I like potatoes, and I like ice cream.
Okay, well, we'll definitely try to get those eventually incorporated back into your diet. Um, in the dysphagia 1 diet, everything needs to be pureed, so that way it's like pudding-like consistency, and there's 0 large or small chunks in the food. It definitely needs to be pureed. So recommendations for dairy include things like yogurt or custard. For meats, you can puree the meat. For example, you said you like fish, you can puree the fish. You can also puree things like beans or lentils as well, which will serve as a meat in the way that you get protein from beans and legumes as well. Fruits and vegetables, they need to be pureed, and what you need to look out for is that there's no pulp or seeds or chunks. And for grains, you can puree things like rice, or you can have malta-meal. Those are two different options for grain to be incorporated into the diet. What you want to avoid are things like cheese cubes and cottage cheese. You want to avoid any meats that are not pureed or that are chunky. You want to avoid things like scrambled eggs or poached eggs, which you might think would be easy to swallow, but then are indeed not easy to swallow. And when you're doing fruits and vegetables, make sure it's pureed and make sure that there's no seeds or nuts or anything like that. There are different things that you can put in liquids that are called thickening agents, and they will thicken the liquid and make it easier to swallow. And a couple of those that I recommend are Frutex and Thick and Easy. Those are two brand names which I believe have helped patients in the past. But my next question for you is, what concerns do you have about the dysphagia in general?
I guess my biggest concern is just not being able to eat my favorite foods and kind of missing the way that they taste.
Okay, I would definitely miss my favorite foods as well. But the speech pathologist and myself, we're going to do our best in order to advance you from a dysphagia 1 diet to a dysphagia 2 diet to a dysphagia 3 diet, and then on to eating normal food. So that's going to be the goal, is to get you back to eating normally, so that way hopefully you can enjoy fish and ice cream again like they're meant to be enjoyed. There's also another long-term option which would entail nasoenteric tube feeding, and that would be where you're fed through a tube that goes from your nose into your stomach. And again, that's more of a long-term option if you're not able to be in a home environment and to where you would need to be hospitalized or any long-term process that would need to happen. I would definitely want to put you on nasoenteric feeding, and that's just because I think it would be more difficult for you because you are a patient with a traumatic head injury and dysphagia as well. I feel like if it took you a long time to recover from this, that the nasoenteric route would be the best. But that's just worst case scenario. Hopefully we're going to be able to maintain your nutrition to where you don't have any weight loss or anything like that, and you stay well hydrated. We want to make sure your fluids are up and that you're getting enough fluids, and we also want just to make sure that you're not malnourished, and we'll do our best to take care of you. But if you don't have any more questions, I'm hoping that we'll see each other, but not for too long, right? So I appreciate your time, and thank you for coming.